call the meeting to order. Would you stand and say the pledge with us, please? I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Let the record show that everyone's present on the board. Okay, everybody look over their consent agenda. Need a motion.
I'll make that motion. Second.
All in favor signify by saying aye.
Aye.
Those opposed? Motion carried. First up, Dr. Elliott, Medical Examiner, and Sherry Dahlheim, Chief Medical Examiner, Investigator, Coordinator, and Jana Limerick, Director, Human Resources. Discussion and/or decision to approve addition of Chief Deputy Medical Examiner, Investigator, Coordinator position and job description for said position. You guys are up.
All right, good morning.
Good morning.
I'd like to introduce Mark Bethel and James Cruzy. They're with the Iowa Office of State Medical Examiner. We collaborate with them quite a bit, so they might be able to provide some insights here and there to some things. So if you do have questions, don't hesitate to ask.
Okay.
Thanks for taking the time to consider this for us. We have, over the several years that we have existed since 2006 with the restructuring, we've seen some growth in terms of the number of cases we investigate, and that is based off of, number one, establishing a standard operating procedure and determining what's reported to us, working with the law enforcement agencies on making sure they're reporting what they need to report to us, in addition to hospitals, hospice agencies, and care facilities. We have seen an increase in that because we've been able to establish that relationship with them and show them this is why we need to have it reported, is to serve the citizens of Potawatomi County, make sure that when their death is certified by a physician, that it's an actual correct certification and we aren't missing accidental deaths, for example, hospice patients that have fallen, or someone that's had a long-term injury and they put it down as a natural death versus an accidental. So that's one of the reasons that we're looking at adding another position in terms of case management. We haven't had a huge increase in the number of cases over the last few years. However, the amount of time that we spend on them is significant. All follow-up on cases is done by me because the investigators in an on-call status work typical day jobs. So they aren't able to do the follow-up. So every single case that comes through our office that we investigate, I'm following up on. So for example, for the month of October, so far we've had 65 total deaths. 26 of those cases we've been contacted on, which means we're doing a report. I'm following up on every single one, even if it's not my case. So this is very time consuming. In addition to that, for purposes of how time is spent, this position would have a high focus on case management as well as supervising investigators, working with them to improve reporting and investigative techniques. And then they would also allow for me to attend training. I have not been able to attend a significantly involved training beyond a day or an overnight in 6 years, as well as getting time off. I can take some time off, but I'm not off. I still receive contact via phone and email, so I'm always available, be it PTO, sick time, or bereavement leave. And then we also need to consider succession for the department. We don't have anything established in that regard, and I'm not saying that I'm leaving anytime soon. I love my job. However, it would behoove the county to have a plan in place to avoid having significant issues were it something that had to be dealt with on a short notice. Also, in regards to disaster preparedness, in the event that, heaven forbid, something were to happen where we had a mass casualty, I am one person. And typically in a disastrous scenario, you have there's one person in the department that will respond to the incident command center. And then you have the people out doing the investigations. And my individuals that work on call all have full-time day jobs. So they're not gonna be able to assist. I am, again, one person, and beyond the disaster, you still have the deaths that happen outside of that, that would still be going on. So, for the benefit of the citizens, we should have something in place where there's at least another individual that's gonna be trained in disaster preparedness, as well as to be able to assist during that process. And then also outreach. In order to improve our work and what we're doing for the citizens, we can improve relationships across the board. We've done that by establishing those relationships in the first place, helping them understand our operating procedure and why it's important to contact us about deaths. But we need to continue to spend that time with them because you have a lot of turnover in hospital facilities, long-term care facilities, hospice agencies, and they don't always understand the processes. We have new hospice agency, show up once in a while, and we have to help them understand what the purpose is. That's also time consuming as well. And I need to be able to spend the time with these agencies, and as well as working with the state medical examiner's office on things, developing policy, procedure, and implementing those things as well. So we really think it would be important to add a full-timer to help with the case management and supervision of investigators.
And that position will also be in the on-call rotation.
Correct.
As well.
So what we would expect to do to offset the expense of it is that we would expand the on-call hours for myself and that individual, and it would decrease the on-call hours for the investigators that work the overnights, weekends, holidays. So it would be estimated this year savings of about $5,000. Next year I'm estimating $10,000. That can be a little variable, but I think that's the ballpark that's reasonable to expect.
Just a little bit more background, back in 2006, I had no idea I'd still be here when they invited me to take this position. And here we are 17 years later or so. But back then it was just a real loose department. My partner and I, Jeff Snyder, decided to take it on. And we've really worked hard over the years to make it very professional. I think, it's so outward facing for the county, with all the families we go visit and take care of their loved ones and so forth. And Sherry continually interacts with them on a daily basis almost. And so as we've developed this, my lifestyle, being in the ER, I used to work 12 hours a day. I was on call at night. I get a call at 2 a.m. and I'd go on the investigations. Well, after a year and a half of that, I could tell that wasn't sustainable. And that's when we hired an investigator assistant for us. And then the department, as it's just gotten busier, we really wanted to do things and tighten up our processes and make sure that we offered an excellent service to the people of Potawatomi County. We've expanded it. And so, I'm on 24 hours a day, 365 days a year, and honestly, Sherry is too. To me, I kind of signed up for that. It's not really fair to her, she's done it over the years, and it's just kind of one of those things where it's like, well, that's the way we roll. But, for work-life balance, she has a family, to be able to get some time off and really be able to turn the phone off. I think this is the next step. It makes a lot of sense. And just to really set the department up to thrive and be very successful as we've done into the future, I think it'd be very beneficial.
And Sherry and I have talked about what are our options here. How can we make this work? Do we have options with using the staff that we have without having to create a full-time position and a full-time, the expenses that come with a full-time position? But again, all of her investigators have other jobs. And they're qualified to do this job usually because of their other jobs. A lot of them are already nurses or paramedics or things like that really give them the skills to do this job. And we talked about, can we repurpose any of their hours? Can we move one of them up? Or if Sherry says, well, I'm going to go to the Black Hills for a week, can we have someone fill in for a week? There's just no way with those on-call staff that she has. They would have to commit to taking time off of their full-time jobs to then fill in for this job, and that wasn't a solution. So we have looked at other options. Are there any other options within the department, and what should her org structure look like? And so here we are presenting to you with Sherry's position, which we'll talk about in a little bit, but then a backup, a successor, an assistant for Sherry.
And you feel that full-time is the way to go? Or
With
can
that-
we possibly look at part-time to start?
Yeah,
I'm-
we talked about part-time
just asking.
too. Do you want to talk about that a little bit, Sherry?
The issue with that is you got the on-call status, and
Mhm.
how do you incorporate what hours they work each week? And then when they're doing on-call hours, how much are they gonna end up having to flex? And then reanalyzing it each year, it's gonna end up being full-time work, because the on-call portion of it, and how do you pay that?
Mhm.
It's separately, because they get minimums for the on-call time that they spend when they take a case.
Mhm.
So you would be looking at a review after a year and paying full-time benefits to an individual on a part-time
Okay.
status.
Yeah, and we talked about too, because with this, the deputy position that we're creating would be exempt, an exempt position because of the leadership oversight that they have over the on-call investigators. But that helps too with that scheduling so that it can be quite variable, right? Your on-call status, we don't know what's gonna happen when you're on call. I mean, really have no idea. And so we talked about if we had to create a part-time for this, maybe we would say X number of hours a week, you need to be in the office doing paperwork, which will be a large part of this job. And then X numbers of a week, you're gonna be on call. They get called in every single time and the investigation takes 2, 3, 4 hours. If it's not a fast one, now we're looking at overtime costs. And we just didn't know how we would be able to control that and predict it either. I think that was the thing, is how can we predict this in such a variable environment?
Could you help me understand the medical examiner's process? So for instance, I'm guessing a death, you don't investigate every death, I'm guessing, but you get referrals or, family from the sheriff's
We
office? from-
investigate any death that is unexpected out of the hospital or within 24 hours of hospitalization.
Okay,
And so anyone that passes away at home, even hospice deaths, they'll call us on. We don't do a full investigation usually if it all makes sense. But anyone that, auto accidents to grandma that dies in bed, it's our duty to make sure to the citizens of Pond County that there was no foul play, there's nothing nefarious going on, they're natural deaths that occur outside of hospital jurisdictions.
I see, okay.
What's the expected cost of this position?
So we're looking at a pay grade 524, which starts at $29.22 an hour and goes to $38.34. So if we just look at the step one of $29.22, let me just do that annually for you.
That's 60,000, plus insurance takes you to 85. Is that in your budget?
Presently, no, that is something that I've spoken with Becky about. We would be doing an amendment for the rest of this year, and then we'd be budgeting for it next year.
I think that's a great conversation for next year's budget. If we can make that work. Keep in mind that we are deficit spending right now, and that would cause us to deficit spend even more. If I can, Sherry, when you spoke of a disaster, if we had a disaster, I would expect Dr. Elliott, he'd be involved in that too, right?
Certainly.
And then you mentioned hospice. If someone's in hospice, isn't that pretty much a predetermined outcome?
Not always. For example, in the event that you have an individual that's been on hospice for a few months and they have a fall and they break their hip, and then they haven't had significant decline during those first few months on hospice, they break their hip and they pass away within 2 weeks. That's typically an accidental death at Dr. Elliott's discretion. Chances are that they probably would have lived longer had that hip fracture not occurred. Benefit to making sure we're doing a proper investigation is to families in ruling deaths natural, accidental, etc. There's an insurance situation there sometimes, possibly.
Well, a fall in a hospice wouldn't be criminal.
No.
No, what happens though is a natural death in a hospice usually is a phone call and a piece of paper to our office, and we're pretty much done, and their family doctor, whoever takes care of them, can sign the death certificate. If it's ruled an accidental death, it goes through our office, we do an investigation, I sign the death certificate.
I do review all of the hospice reports that do come through our office, though. We ask for specific criteria from them to ask if there's been any falls in the last 6 weeks, if they've had any exposures to toxins, that would also qualify for an investigation. If they're quadriplegic or paraplegic, that would require an investigation. So sometimes they just send them to us and we haven't been called, but they've checked the box, and so I do my follow-up. So I check every single hospice report that comes in. So essentially, every death in the county I'm looking at, except for the inpatient natural deaths, because we do not get notified on those.
So from 2021 to 2022, the deaths are actually down. In what you provided me, case stats for Pot County, total deaths,
Yes.
and of
Yeah,
those,
there's kind of a natural variability through the years. It's been fairly static. The one thing that was very interesting last year was we had 10 more suicides than we've had in the recent years.
Sherry, I want to thank you for taking the time to explain all the acronyms and
Sure.
all of the numbers that go along with the data you provided. I just have a couple of questions. In the job description, it seems like there's quite a variation between what you say, entry, the step 524, and your current step, and you talk about succession planning. Is there something in the job description and in the budget to allow for the additional training that this person would require in order to receive the certifications that they need in order to totally replace you? I didn't study it in great deal. I don't know exactly what the requirements are. I just want to make sure that when we're talking about budget, we're allowing for that educational component as well.
The way it's currently structured for all medical examiner investigators, we all have a baseline requirement of education, and that would be the medical legal death investigations course that's offered either through St. Louis or now through Des Moines Area Community College, coordinated by the state on that one, and to be certified with the American Board of Medical Legal Death Investigators, the ABMDI. Beyond that, it is also expected after a certain amount of time that you receive the master's level course of medical legal death investigations training. If the individual's salary, that's worked into the cost. However, presently, all on-call investigators can receive training. We do have training budgeted already in our annual budget.
So the answer is it's already pretty well budgeted for education.
Yeah, that shouldn't be an issue.
And we chose the 524 for this position because that's where Sherry's position is at today. And this new position, although will be Sherry's backup, is doing a lot of what she's doing today, but when we take a look at her job description, then elevating that a little bit. So that's why we chose the 524 for this deputy position.
did you take a look at some of the other 10 counties that we're kind of compared to across the state of Iowa, and how many people they have in their office?
I have looked at several counties, and unfortunately, every single county is structured differently. There's no rhyme or reason. There's no requirement by the state that you have to structure a specific way. There's just requirements on qualifications to be an MEI, qualifications for an ME. There's no requirement that an ME has to be an employee of the county, contracted as an individual like Dr. Elliott, or contracted through hospital. So the way they structure, it's all very different, and it's really not comparable. You're comparing apples and oranges. They're both fruits, but they're both very different.
How many of them, oh, sorry.
No, go ahead.
How many of them have 3 leadership or management positions?
There's several. I looked at quite a few, but it just depends. We have some that, when I talk to Dallas County, they take a 24-hour shift, but they also have other jobs. Some of them are more rural, some of them don't have as many cases, It really just depends on their workload. Johnson County has 7 full-time MEIs. They also have an administrative manager, and they have an investigative supervisor, and they have 3 medical examiners. However, they're doing their own autopsies. So it's quantified through that.
Over the years, we've really tried to compare ourselves, but it's just very difficult because people do things differently, throughout.
Mark, could you speak to that a little bit?
Yeah, how would you, as far as?
Like how every county's kind of different in terms of the structure,
Or
what you see on your side.
or what best practices would be from the state standpoint?
Yes, so Iowa has 99 counties. 97 of those 99 report to our office. We're projected to do around 2,000 autopsies this year alone. The number is increasing for a couple of different reasons. We see a wide range of the quality of work by both medical examiner's office and law enforcement offices throughout the state. There's a huge range. Pot County is one of the shining stars, if you will. Both James and I are investigators for the state. Personally, I'm always happy to take a case from Pot County because it is always very well organized, it's detailed, they answer the questions that we need at the state level to further the investigation. Sherry's always available. We don't receive that kind of support from every county in the state, regardless of the population and the number of county level ME cases they may do. There's a wide, like Sherry had mentioned and Dr. Elliott, a wide range of counties that may have a single medical examiner, a deputy medical examiner that will fill in when they're out of state or unavailable, and a number of medical examiner investigators or MEIs. I worked with Pot County's stats and Dr. Dennis Klein, who is the chief state medical examiner for Iowa. The entire state answers to him. We compared figures, caseloads over the past several years, including last year, to the accreditation that our office falls underneath, which is NAME, the National Association of Medical Examiners. They have a staffing matrix where they're able to, you can plug in the number of deaths in a county, and it will give you the number of full-time employees that they should have, medical examiner, deputy medical examiners, and MEIs. Pot County is well within that jurisdiction. I guess they would fall another full-time employee, which Sherry and Dr. Elliott have described, is completely reasonable given the number of the volume of cases that they're processing each year, the types of cases they're processing each year, and keep them at the level that they are right now. I'm responsible for about 600 MEIs and physician medical examiners in the state of Iowa. I'm our outreach training development coordinator in addition to investigations. I travel around, I do these meetings. I'm going to be in Floyd County a month from now for a similar type of situation. The way our office and the way I measure the health of a county medical examiner program is on, it would be this sheet right here. It says Potawatomi County, it's 2023 year-to-date statistics. The third line item over is the percentage of 34%, ME contact percentage. NAME standards are at 20%. NAME views that as a good figure, that the medical examiner's office at a county level is contacted for 20% of the deaths that occur in that county. NAME feels 20% is their standard. Our goal for counties is 30 for a number of different reasons. But even this year, they're right at that or above it a little bit. So it is a very well-oiled machine here. I know her hair is on fire. To give you an idea of my background, I've been in this field for 24 years. I was in the field of Marshall County for 20. I have about 1,600 scene investigations underneath my belt. I'm board certified medical legal death investigator. My father is still the county medical examiner for Marshall County. He's been there since 1983. So I grew up with a father who had Dr. Elliott's and Sherry's role. Never saw him. We just never saw him because he was a physician outside of the ME work, and fills a lot of the same role that Sherry is right now. In addition to Dr. Elliott signing of the death certificates and cremation permits. And that's one area that I don't think we've talked about yet is cremation permits. That's another, burden's a poor word, but another requirement of the county medical examiner is to issue and sign a cremation permit for anybody to be cremated in that county by funeral, if that makes sense. So there's a certain level of investigation there too. We're not going to the scenes. They're not going to the scenes, but they're still doing all of the back legwork to ensure that it's not a medical examiner case. And if it is an ME case, then they work that up. They're behind the 8 ball already, because usually the individual is at the funeral home, may or may not have been embalmed. So cremation permits are another responsibility of both Sherry and Dr. Elliott and their team. Touched a little bit earlier on hospice cases. I can remember when hospice was this big in the state of Iowa, and then it became a business. Everybody wants to provide outpatient hospice services. The elderly demographic that are hospice patients in the state of Iowa and throughout the country, that is the most vulnerable demographic or I guess death circumstance that you will encounter just because they're not in a medical facility. There's room for families to give them too many pain meds. There's room for them to want to be given too many pain meds. It's not an easy thing to manage hospice cases. The medical examiner's office, as far as Polk County, all 99 counties in Iowa, the county level provides an insurance policy for you as supervisors for the deaths that occur in that county. It's a very wise investment to support your county medical examiner, which you have. They're dotting I's and crossing T's as far as identification, positively identifying someone. You have one chance to make that mistake, and it would be your last mistake because it's a career ender, even for the physicians in our office, the pathologists. The single biggest thing we do is identify individuals. That's more important than cause and manner, because if you release the wrong individual to the wrong family, you're with me there.
Yeah.
And there's even a higher percentage for that to happen at the county level because they don't have all the tools that we have. They don't have access to DNA. They don't have access to dental records sometimes. They don't have access to the x-rays we do, or to the forensic pathologists and the DCI that we work with. So it is very much a lifestyle. Very few people understand the demands, and there's no room for any mistakes. You guys, as a group right now, cream of the crop, definitely in the top 2 or 3 in the state, I would say. We're here to support Sherry and Dr. Elliott to help them maintain that longevity of employees, investigators, of Sherry. That's the other way we measure at the state the health of a county medical examiner system is if you keep the same people employed, even if they're part-time, those relationships that are built with law enforcement, with hospice organizations, with administrators of hospitals, you have to have that relationship, which you do here, in order to be notified when someone dies. They have to understand what the medical examiner system is, the purpose behind it, and have that open line of communication. There's a very high volume of turnover in long-term care facilities from an administrative standpoint, let alone employees, as well as hospitals. ER directors come and go, nursing supervisors come and go, and those are the linchpins between their facilities and Dr. Elliott and Sherry and their team. So they've hit home runs there as well. Sherry's going to be helping me come up with some curriculum to help train other counties. So I know this is a long-winded answer. I was hoping I had a chance to speak to you. But the true health, the way we measure it, is that ME contacted percentage. Because if they're not being contacted, you're missing deaths that are going to be unnatural, that will be litigated. And that's, I guess, my position. One last thing, the whole suicides are up 3% for the year 2022 nationwide. A lot of that's trickle-down effect. I believe there's not a real clear-cut answer in print now, but I think a lot of that trickle down is mental health from COVID. We saw an abnormal number at the state level, an abnormal number of accidental overdose during COVID because the users had nothing else to do but stay home and use. Fentanyl has increased. We've all heard about fentanyl in the state and the nation. It's in every tox case that we have in Ankeny has fentanyl on board. It's in everything. They cut it. They know it's in there. So COVID changed a lot of stats, not only for the state of Iowa, but for the country as far as medical examiners. In Marshall County, over the last, I guess, 30 years, 35 years, we average maybe 5 suicides a year. Every now and then it'll blip up to about 12 or 13 for no apparent reason. There were some added stressors to a certain demographic for whatever reason. A lot of times that can be tied to financial. A lot of times it's tied to new drugs that are on the street. Somebody's teetering that's enough to put them over. But that little blip that you saw last year, I mean, it's not a little one, it's significant. It's not uncommon. And it may level off or even go lower for years to come. So the calls just come as they may and as they will. There's really no rhyme or reason to the unnatural side of things. So.
If I could piggyback off of that, Mark talked a lot about variabilities there, and you just never know what you're going to get. And these numbers fluctuate on the number of deaths we get, the number of autopsies we're working. And in defense of this department, since 2006, we've either been at or under budget with at least 7 line item variables in our budget every year. So we're pretty proud of that.
You and I have talked quite a bit about your process and the amount of time you spend in the office and out on the job, so to say. And it does look like you need help over there. And I think it's very important for this county to back you on that. I know we have discussed how our budgeting is, and we knew we'd be doing some deficit spending this year. We don't want to get carried away with it or anything. When are you looking to add someone?
We would like the position approved today and to be able to hire within the month.
When was the last time, Sherry, you had 3 days off that you could just turn off your phone and get away from work?
2016?
What year did you take the job?
Yeah.
That's what, yeah, you took the job, I think in 2017.
I mean, even when
Yeah.
I took a vacation a couple years ago to Cancun, I had one investigator that was available days. However, they weren't in supervisory role or anything, but they were able to cover call. And you know, I said, contact me if there's an emergency, but I still did my check-in and had to do some work while I was on that vacation related to employee issues of, you know, 2 people got hurt that February, and they were, well, I just, you know, they told me they got hurt, and I'm like, they have to come off the schedule right now. They cannot work injured because we got to worry about liabilities. That person doesn't know that. The person that's covering me doesn't know those portions of the position to understand what's necessary in handling certain circumstances. So, yeah, since I started the
Yeah, and I
position.
think, like, just to reinforce, you know, Mark mentioned, it's basically a county insurance policy. You know, the cremation permits that come through our office, and I'll catch something on the history or something, and we do more investigation and so forth, just to make sure we're not missing something. And then if you look at, you know, you burn someone out like Sherry, what's the cost of turnover there to try to find someone and hire a new person? So I think over the years, you know, this is long overdue. I think it'll pay off dividends for certain to keep this department healthy, you know, keep the service that we offer the community, you know, second to none in the state and probably throughout the United States, honestly. So we appreciate your support.
From what I'm hearing today, I'm very impressed with you folks, with your office. I would certainly like to find a way to go forward. There's a reason you're here, and I understand the reason. So that's where I'm at right now.
I don't have any issues with it, Sherry, if that's what you want to do. We are just about ready to begin our discussion for next year's budget. And I would like for that, this is just me, I would like for that to be a part of your discussion for next year's budget. As I mentioned earlier, we're looking at, I don't know, a position that's $80,000. We are deficit spending. I really don't want to deficit spend anymore, so I don't have a problem with the position. I think I wish that the discussion could have happened for this year's budget prior to today, like last March or January or somewhere in there. We need to recover from our deficit spending that we currently have, and I think adding to it is, at this present time, is something that I can't support.
My question would be is if we were to delay, would we still be in deficit spending possibly the next year and then be delayed again and again?
We have a plan to get out of our deficit situation in, what is that, maybe 4 years?
It might be faster than that.
4 years, maybe faster than that. But you know what? This board doesn't really know. We had a countywide reassessment. We had some legislation that happened in Des Moines that at least this board member is not 100% sure what that even means. We're still trying to work on it. And so once we get our valuations from the assessor or auditor, we can start taking a look at what legislation is doing with our valuations. So I hope as Mitch just said, that there's a possibility we can get out of this hole a little quicker than normal.
And we've really discussed part-time and how that possibly would work, but I think the level of education, level of knowledge, professionalism that this job would require, we're not going to get that person if we don't offer them full-time. I think it would just be too difficult.
We do still continue. We have been very fortunate as a department. We are tempting fate, however, by continuing to deny the filling a position by not, having acknowledged it up until now. We've talked about it for a while, but we should have acted long ago. But continuing to go without it, again, tempting fate, something happens to me, I get really sick, or God forbid the worst happens, we're in trouble. The department will be in trouble.
I wonder if we could start this position in maybe April 1st. Just throwing stuff out there to be thinking about.
We're certainly willing to look at all options, and whatever. You totally understand you have fiscal responsibility.
Well, again, I have talked with Sherry quite a bit about this, and it does concern me that she doesn't get time off. We could burn her out and may have already, but you need to go on vacation and get away from the phone. Doesn't matter who you are.
She does her job, which is, a huge benefit for me and the county, obviously. And so have a chain around her neck, she can't leave.
You're right, and it's not like we haven't been trying. We increased the number of on-call people. We increased the, help me with this, Sherry, the hourly rate for on-call people.
Correct.
So we were trying to get some help there too, and if that's not working, the next step is to take a look at hiring somebody under Sherry. I don't have any issues with that.
Yeah, there's no doubt this board's been very supportive, and we've appreciated that over the years.
We need to have redundancy. I mean, we can't afford really to have, who would we go to a third party to hire if something would happen with her?
Sherry.
Yeah.
The amount of time it would take to train an individual if we couldn't hire within for my position as it stands today, if they don't have specific death investigation experience, that alone for my on-call investigators can take up to 2 years before they're really, really thoroughly trained, because you just don't know what you're gonna get when you're gonna get it. And working at full-time, you'll have more exposure to that, but it would be at least a year on the investigations piece, which a thorough understanding of that is necessary to do the operations of the department.
So what's the difference, and maybe we have to have Mitch work on it or Jana work on it. If we would have this person, then that would lessen, if I'm hearing this right, lessen some part-timers' hours. So what, dollar-wise, I think you need to come back with
That's where that 10,000 a year, you know, but we would hope we'd be able to save more than that, but honestly, the on-call hours, they add up, but it's not enough. You know, it'd be nice if we could offset this 50% by on-call, but we don't. But that's probably about 10 to 15,000 a year is probably what we're looking at on the on-call side.
The, help me if you can, Matt, if I make a mistake here, but I think Potawatomi County is required to have a medical examiner. Dr. Elliott actually hires the staff, or recommends hiring the staff, is that correct?
Yeah, you know, I'm an independent contractor, and so I'm not an employee. I wish I would have been back in 2006, it would have been pretty nice. But at any rate, so Sherry actually is the county employee. And,
Exactly.
and under my advice, obviously, and overseeing, we hire and so forth. But she's the one that is directly responsible with myself to the board as well.
Anything, Susan?
Got to understand the numbers. I'm kind of like Brian, if we could hold off until the first quarter of '24, but I know that you haven't had time off for a long time.
It would be nice.
Well, the county's come a long way. 20 years ago, we had one person. And without saying this person's name, he hardly ever showed up. And we went from, I don't even know what this
It cost
person.
$30,000 for him.
How much was it?
30,000.
I wasn't going to say the gender, but since you did.
Oh,
So,
Yeah, at
under
that
the
time, I
advice.
think an investigation was maybe a phone call, and on a good day, drive the, whatever vehicle the body was in, to the back door of the office and take a quick peek.
I mean, I've talked with Matt Wilbur about this a couple of times, and, you know, we do have a responsibility. But I want to try to do things within our budget, so we're not deficit spending anymore. And, you know, if you want to, how long do you think it would take to find somebody that's even workable?
I would like to
Matt?
hire from within.
You know, we have a couple of really good candidates that probably, we don't know 100%, but we're hoping would take the position.
Okay.
And-
Matt,
and
would
so-
you like to add something?
Yeah, I just wanted, since, you know, Timber, we have had some discussions, not necessarily about this new position, I wasn't aware of that, but I've got some history with this, working with this department since I was definitely, you know, county attorney when we had our former, you know, situation. And the difference in quality of investigations that we have now, I mean, I just can't even tell you the difference. And we have a fentanyl overdose death that the police were sort of just not even really looking at, and Sherry showed up, and it turned into a pretty significant investigation, which actually led to, even though the death actually turned out to be an accidental fentanyl overdose, it ended up with some pretty serious felony sex assault charges that we're currently prosecuting, and that absolutely was not even going to be spotted had it not been for Sherry arriving on the scene. And her job is a little extra complex because we are a border county. And we're a border county with two trauma units that are in Omaha. They're not not here. And so anytime we have somebody that codes in Council Bluffs, they get transported to Nebraska where they're pronounced dead. Even if they're not ever, they don't take one more breath, they don't have one more heartbeat in Council Bluffs, they are shipped over by ambulance to the trauma unit because everybody's trying to, do CPR and, try to take, extraordinary measures. And when they're pronounced in Nebraska, that creates a huge, it's just a big difference that we have to deal with because she has protocols now in place with Nebraska and their coroner's office because they have a different system than we have because they will not autopsy a case in Nebraska when the reason for death happened in Iowa. And so we have to go through a very sort of complex jurisdictional problem for me on behalf of the county attorney's office to accept jurisdiction over the body so we can then transport it back to Iowa and then go off to Ankeny to get an autopsy. And I've been on the phone with Sherry or her investigators at 2 in the morning many times, as we're dealing with those. And that's just something different that Potawatomi County has to deal with really than any other state or any other county, because we are the only county in Iowa where most of the metro is in a different state. Des Moines, all local. Davenport, halvesies. In Sioux City, most of it is in Iowa. Potawatomi County is the only county where most of our metro we actually have no authority or jurisdiction over, and it creates some extra issues. I'm maybe a little overly sensitive to employee wellness issues right now, but I'm telling you that that is my biggest concern for Sherry is that she hasn't had a longer time off in 7 years, and that's just bad.
Total job burnout.
Yeah, so I don't know.
We don't have
I
any.
can't speak to your financial situations, I don't know that, but I want to tell you that having seen the quality or lack thereof of work out of that area, and once Dr. Elliott came on board, and it was before it was Sherry, I think we had Karen Foreman, but once we sort of professionalized that department, the quality of work that I see and done, I've had to have Sherry on the stand, in my cases, so it's not like, they've got a lot of responsibilities and work, but I certainly appreciate what they do.
We have no trauma center in Council Bluffs.
No, RERs are, they're fine, but they're just not what we call level 1 trauma.
Okay.
So anytime you have those level of cases, they either go to Creighton or UNMC. There's a couple of them that are sort of on rotation, I think. But we just don't have the facilities here that they do.
Okay.
An
All right.
example to reference what Matt just said about me testifying in a case. I am set to testify in the middle of November, and I've worked up the schedule this week, and I don't have coverage. So I have to let the comm center know, hey, I might, and they can't give me a day or a time when I'm gonna testify. They can estimate it, but I have to be available. I'm subpoenaed. So there's an example of, we need that additional coverage during the week to be able to afford us the ability to do these things with, I'm on call right now. And I told comm center, I won't answer, I will call you back. But we need to have that coverage as well.
Sherry, what happens if you're testifying and you don't have coverage? Do they just wait for you?
Well, what I determined, it depends on what it is. I might have to go up to Matt and say, hey, Matt, I really have to go on this one. We've got interstate shut down. That could be a huge problem because you might have potential for secondary accidents. And shutting down the interstate involves multiple agencies, and you want to get that back up and running as soon as possible, especially if you've got a situation with some weather issues, what have you, or something that's visible. We want to protect the public from having to see certain things. So yeah, it would just depend on what the scenario is. You've got officers or deputies that are out of service when they're on a death scene waiting for an investigator. So we want them back in service because if there's something that occurs that they're needed at, they can't just leave. So me having the delay would also cause an issue for them. It kind of trickled down effect as far as that goes.
I agree with Tim about the deficit spending at this point. It is an issue with the board and with our budget. But then we are deficit spending, and so we have to deal with priorities. And I think yours and your office, in my opinion, is a high priority. So that's where I'm at. Okay, and that's how I would like to go forward.
Can we look at April 1st?
I think you've justified the need for it. I think that, I think we could ask Mitch to, survey some other departments to see if there's some funds available that we can take from them. Or let me rephrase that, not take from them. If there's some funds in some of those other departments that they're not going to use and they're, may or may not have a plan to turn it back in as, in our reserve, that we may be able to come up with some funds. I'm willing to take a look at that. And see where we go from there. How about giving us 2 or 3 weeks to take a look at that and see if we can find some funds without increasing our deficit spending anymore.
I could get behind that.
I agree.
Makes you feel any better, I was gonna ask for double of my salary too, but he said not to.
Does that help?
Which has actually stayed the same since 2014. And in regards to our budget, we have not, in the last 4 years, we've only had a 4.25% increase in our budget. Since 2010-11 fiscal year, we've only had a 40% increase. So it's been growth of this department, but we're still under $500,000 for our budget. And that's over the course of several years of growth where we haven't allowed the rest of us to grow proportionally.
So are
I
you
think
saying
that's very
you'll
fair,
have,
if you take 2 or 3 weeks and look around, that'd be great.
so are you saying you will have extra money in your budget?
I could by the end, it depends on those 6 line item variables. I could, but
Well, you mentioned promoting from within
Correct.
to fill this role. Would you backfill then for that person
Which-
that's promoted?
if we did, it wouldn't, the on-call positions, it's hour per hour, so that doesn't affect, the only expense for a new on-call investigator is the training time. And we're
It doesn't
budgeted
matter
for
if we
that.
have 2 on-call people or 20 on-call people in the hopper, they only get paid if they get called in, and so it's pretty much the same.
And
expense.
one on-call for, per shift.
Why don't we relook at it sometime around Thanksgiving again? Mitch, can you go over things? Has
Well-
anybody got questions?
Well, yeah, I guess today, they're asking to approve the job description. I guess I'm okay with doing that. And see what comes later with funding the job position, I guess.
Okay.
That's what we should do, or?
Is it,
I
was
think
that,
it is.
was that a motion to approve the job description and hold off posting for 2 or 3 weeks?
Yeah.
The only thing
Well,
that I
I'll
was,
second that then.
the only thing that I would say though is if based on what we can find financially, if we have to change it from a 524 to something different, then we're gonna have to reapprove the job description again. So I would maybe say that it sounds like you're very supportive of this. I would approve the job description when we know the funding, but it's whatever you wanna do.
I think the funding's gonna be a big part of it, so.
What are what are you thinking, the funding's gonna go up?
Well, our hope is that Mitch can find some magical money to help pay for this. I know this is probably not gonna happen, but no, to say that it could go down. Today it's a 524. We don't want it to go down in grade, but if it comes back where the board says this is all we can afford, then I think Sherry and I would have a conversation and see what we would say. So I just don't want to approve a pay grade right now if we don't know that we can fund it.
Well, this motion doesn't have a pay grade.
Well, the job description does, on the job description. So if you would approve the job description of the Chief Deputy Medical Examiner Investigator Coordinator, you'll see on there it says non-union pay grade 524. Yes, we can always change it in the future. So if that's how you want to do it, that's fine too.
Leave that blank.
My concern with changing the pay grade to reducing it is the fact that that pay grade is selected because based off of what investigators make, if you take that pay and make it full-time. and that adds supervisory experience that's needed to make it a compensation that's reasonable, that's where it needs to be.
Yeah, I would feel comfortable. I don't think we're gonna find anyone for less than that, so.
Even if we were to go this route and Mitch was able to find some departments that could possibly have some funds to help out, we're taking, if we hired in December, we're taking a $100,000 position and paying 50 for the rest of the year.
Correct.
It's not like we're looking for $100,000.
Correct. And there's a possibility, you know, that you may not have the expense of the insurance benefits if they don't opt for them. I mean, that's a possibility that would make it less expensive as well.
You plan for the worst and hope for the best, right? Okay. All right.
So-
Whatever you want to do, Chairman Shea. it doesn't
So how
matter.
do you go forward? You don't want to go forward and see what you have for candidates until we figure out if we got some funds, is what you're saying.
I guess, correct.
Okay,
My concern is that if the funds aren't found, you might be forced to find funds anyway, should something happen to me. That's, I mean,
right,
that's
no,
the
no,
bottom
no,
line.
that's-
It's
We
gotta
need- we
happen
need to-
one
we
way
need to
or
get
the other.
we need to get the redundancy, and it needs to happen not just in your department, but throughout the county, to have someone that can back up
Yeah.
as a backup, you know?
We're not gonna stop deaths.
No, and I'm currently the only department that has one person, full-time, running the
Right.
entire department. So there is zero succession.
So does the board want to table this? Speak.
Well, Scott,
You got a motion or not?
I don't have a problem with the job description, so if you want to approve
No.
the job description,
Yeah, that's what I would say. We can get the job description approved and we decide on the pay grade later.
Is that your motion?
Start with the, you know,
why would we change the pay rate?
I don't think we would. It's like Dr. Elliott said, it'd be hard to find someone.
yeah.
Make the motion,
So
Scott.
how about if you approve their job description, but you don't have approval to post it until we find some funds?
Mine's not.
That could be-
You've got two motions here. I think one is for the possible new hire and then one to change Sherry's job description.
No,
Is that-
we're just doing this first one.
Yeah, but they kind of go together. The second request is for,
Why don't we just hold off on everything until we can find some funds? I'm okay with that.
Mitch, how long would, you think how long would it take to take a survey of funds that might be?
Depends on which departments want to volunteer some of their funds.
Well, we can start with the auditor.
No, we'll look for some of them been posted
We'll
for a
just get
while.
next year's election.
Mitch is gonna get a lot of unanswered emails.
Right.
I can make it.
Yeah.
I just think we're kicking the can down the road here.
Well, we gotta have a way to fund it.
Well, we really appreciate your consideration and your support for our department.
Okay, appreciate you coming in and coming over, and the kind words you had to say about the department. You know. Who are those two other counties that you said were outside the 99?
I'm sorry,
You said there was 97 counties that were,
Johnson County,
oh, because they do their own deal?
forensic pathologist there, and then Woodbury County
Okay,
also. We do some of Woodbury's cases, kind of a difficult one, it seems like.
Imagine
by
that.
nature. But, one last thing for me, this ME's office is very fortunate to have you as supervisors right now. I don't see this level of support and genuine interest and seem to do the right thing, even though it's difficult, right? I don't understand the numbers either. I'm not a numbers guy. I do interview people for a living, and I can tell you're all genuine. You all make great sense. And the community, the county, I guess, is very fortunate to have you in the chairs that you're in. So I don't see that all the time.
Agreed.
thank you.
Thank you very much.
You'll get together with Becky a little and work this out.
Yeah, we'll get something back to you guys.
Okay, so we'll table this at this time. No action taken. Okay. Next up, same group, title change, pay, job description for current Chief Medical Examiner Investigator Coordinator position.
Purpose of that is in conjunction with the position being hired and filled that we just discussed. So I think it's a moot point right now.
Okay.
Okay.
That no action taken. Okay, thanks. You guys,
Thank you.
you're welcome to stay and watch the rest of this meeting. It was a good discussion. I really appreciate it.
Thank you.
Thank you, Sherry. Thank you, Doctor. Melvin Hauser, Auditors, discussion and/or decision on appointment to the Waveland Township Clerk.
Okay, you got Janet Shearer's resignation
Mm-hmm.
as the township clerk in Waveland. Waveland is the only township or the trustees are not elected, and so they're appointed by,
Why aren't they
folks.
elected, Melvin?
they chose several years ago to, it was put on the ballot, and they chose to be appointed rather than elected. And there's a reason behind it. I can explain it to you some other day.
Okay.
But basically it was, there was a gentleman they wanted to keep off the ballot. So they says, we're gonna pick our own and recommend to you to have them appointed.
So this position would be to fill out Janet Shearer's.
Right, she's resigning. They found a replacement, Nancy Potter is going to do it
When
And
would
I
her
think-
term end anyway?
today.
No.
Oh,
When would her appointed term?
they are up every, I don't know, I can tell you, if as appointed, she'll be a 4-year appointment. And
This
if she
will-
might be filling out a 2-year term.
That's what I'm asking.
I'm not sure. But they're appointed, they'd have to be appointed at every
4 years.
4 years,
Okay.
4-year term for the trustees and the clerk.
All right.
So,
So we just need a motion to accept her resignation and appoint Nancy Potter as Waveland Township Clerk.
I'll make that motion.
Okay.
second,
Do a roll call, Melvin, please.
Okay. Chairman Shea?
Yep.
Supervisors Wickman?
Sure.
Bell?
I
Miller?
Aye.
And Jorgensen?
Aye.
make a motion to appoint Nancy Potter to the Waveland County Clerk.
Oh, I
I
thought
thought
that's
we
what
did
you
it all
just
in one
did.
motion.
We done.
Township. What?
I thought we did it all in one motion.
That's what,
You guys did?
that's
Yeah,
why
that was the motion, was to appoint Nancy.
Oh, I didn't hear,
accept the
I didn't hear
resignation
that.
and appoint her.
Okay,
So it's all done.
okay.
Okay, so will you get back to us, let us know what time she's got left on that board?
Sure.
Today or
And
last?
it'll be a,
She's done.
No, the new one.
Nancy.
Is
the
she
new one.
filling
Is it a
out the
2-year
term,
or
or
4-year
is she,
term? I don't know.
has she got a year and 3 months, or 4 years, or, you know?
Well, the
Jody's
position might have been up, and since they're appointed, I don't know if they are appointed for terms. If they're elected, they're elected for
So she may be
4-year
a
terms.
4-year term starting today.
I'll check on that.
Okay, just let us know, please.
But I think it's a great opportunity to thank Janet for her many years of service as well. 'Cause I know she's had that role for a long time.
It's a thankless job.
Pretty much.
It is. You only hear when people are mad.
Well, I don't know, they get mad if the cemetery's not mowed, or if the guy that's mowing the cemetery cuts off the peonies. You know, that's the biggest issue they get, I think.
Sure. Okay, next up, David Bayer, Chief Information Officer for IT. Discussion and or decision to approve and authorize the chairman to sign City of Neola County IT Support Agreement. David.
Sure. So this is a little agreement. They have 19 cameras around the town, and we have a system that can support that. And so they are wanting us to provide that service for them, where the cameras would be inside of our software. They would be viewable by them, but they need some IT involvement to do that. So
Is there money?
no money, no.
Just you monitor?
We just make sure that the right people have the access
Okay.
to those cameras.
And that's a city program, not a sheriff program or anything?
Well, no, it is our software, the county software that the sheriff, court security, jail, all use. So they would have access to those cameras too, so it's kind of a trade.
Okay,
We would see those cameras, but then the city could also see their own cameras, but not see.
So the city's bought the cameras, but they don't have the software.
They do have current software, but they would use our software instead.
Okay.
And then we would have access to those cameras too, and they would also have access to the cameras. So it's a win-win. They still get to see our cameras, but we also get to see their cameras. But we've got to make it available on their computers,
okay.
right? So VPN access and account setup and creation, those kinds of things.
I know we've got a few set up in Crescent through the sheriff. That works out really well.
So does the city council of Neola decide who gets access to the cameras then?
It would be, the city clerk would just tell us who should have access, and then we would rely on them to tell us.
Really? Oh, okay.
I think that's the way it is in Crescent too. Not everyone gets access.
Right.
Okay. Questions, comments? Motion?
I'll make the motion to approve.
Second.
Okay, all in favor signify by saying aye.
Aye.
Those opposed? Motion carried. Thank you, David.
Appreciate it.
Next up, Sheriff Andy Brown, discussion and/or decision to approve and discuss additional school resource position for the sheriff's department. There's that.
Morning.
Good morning, everyone.
Round two, I'm not sure where we want to start, I just want to say, last week, things didn't go as I planned essentially, and I did come unprepared. I don't know if there was questions or answers that were answered inappropriately, but we're here today to answer all the questions you guys have for us. So I'm not sure where we need to go from here, if we just need to go to the questions, or, because I'm on the same stance as that I still have this second position that's funded by the schools.
Okay, the second position, there seems to be some questions about a 2080 agreement.
Yes.
Is what seems to be the big stickler point. Matt, do you want to speak?
Sure, I'll chime in. I've got a copy of the current agreement. It is not a 2080 agreement. It's just an operating agreement between the school districts and the sheriff's office. I got that yesterday, took a look at it. It's actually pretty well written. I mean, I didn't have a part in it, but honestly, everything I would have asked to be in it is in it. I think it's probably a repurposed agreement from an already existing SRO agreement with another school district. So I would rather it be a little clearer on, I wouldn't mind there being a tighter indemnity clause. Just, this is very clear that it's a sheriff's office employee supervised by the sheriff's office. It is not a school employee. It is not supervised by the school. That they are there for law enforcement purposes, not for discipline purposes. I mean, I think all of those are very good and clear. If I was going to add anything in a future 2080, we would do that. I would just want there to be some clarification that in the event there was ever, the person was construed as an agent of the school, that the school is responsible to cover us, in those events. I mean, honestly, that's a pretty small ask. This probably gets us 98% to where I'd want us to be anyway. So as far as the current position where Corporal Ferguson is acting as an SRO, I think we're fine. I contacted the state auditor's office to make sure that it's okay to fund this position out of the general fund. From a legal perspective, they say as long as it's a public purpose, and certainly law enforcement protecting schools is, that they did not see a concern. With that, whether it's politically something you should do or not, I don't have to worry about. Legally, it's not a problem. So funding it, Andy gets to assign his deputies where he wants to assign them. And this is for the existing position, I think it's fine. Obviously, for creating a new position, we'd need a 2080 agreement, which the board would have to approve, and then any school board would have to approve. My understanding is that's sort of a hybrid funding, right? The school's going to cover most of that, but not in the summer. So you'd have to approve that position. I don't have any doubt we'll be able to come up with a 2080 agreement. If it's something you want to do, I guarantee you there is a 2080 agreement in 20 school districts around that I can grab and start to do the work on. So I don't have any problem with the concept. It's just a decision whether what direction you want.
Isn't the school district already taking care of this one that you got, this current one?
No.
Oh, they're not? Well, I thought they were.
No, this is what I discussed last time where we had that vacancy in the court security division, and I used that position for a school resource officer.
Okay.
Just to get somebody introduced to the schools and see what the superintendent's thought about it. So far, it's been successful, so.
And you're saying the new position would be funded how much?
So each-
20,000 each,
Yep, 20,000 each,
times 5,
times 5, 100,000, yes.
and then only work 9 months of the year?
So they would work for the schools 9.5 months out of the year. They would work for the sheriff's office the remainder. This is what Council Bluffs PD does now. There was some discussion last time how Council Bluffs PD was 100% funded by the schools. It's not accurate. They actually are funded for the 9.5 months out of the year. The city's responsible for all their benefits and healthcare and stuff like that. So, and the other 2.5 months out of the year.
So what would they do those 2.5 months? Would they go to roads or back to the office?
Either or, it depends on where we need them, what vacancy needs filled. Like I discussed last time, this is a good time for their training to happen, where they'll go to their national and local certifications. We're encouraging user vacations over those 2.5 months. And if the schools need them for something, they can still do something for the schools, but otherwise they will work for whatever we need them to do. So roads essentially, the specialized stuff we need them to do.
So out of the 9.5 months, they'll be darn close to paying their full way at that point, won't they? For 100,000?
Yes, it would cover it.
We'd have to cover
it's-
benefits.
It's not necessarily like apples to apples, because even with Council Bluffs, I'm not exactly sure the exact dollar amount that they actually get for those 9.5 months for a officer. Because, probably a third of their salary is, medical, IVers.
Right.
Or I should say that they're in 411 or whatever for retirement. So I would roughly say that for the money that they're going to work for, the 100,000, that could easily cover a deputy's position, yes.
Andy, can you provide us the numbers that gives us the cost of a deputy?
Yes.
Their wage, their benefit, their IPERS, their car, their fuel, work comp.
This is very, very close to what it would be on this sheet here, so.
Okay, we haven't seen that.
So an annual cost for a deputy is $114,580.
How much?
$114,580.
That include a car
Yes,
and fuel?
yes. Uniforms, dental, family health, FICA, Medicare, IPERS, salary, all the above.
Work comp?
Work comp. Yeah. Is it covered in something else?
It worked out. But that's a starting position.
That's a starting, okay, so what is it for a corporal? Because that's what he wants to put in there.
We have a corporal in there now.
No. I thought I just heard Jeff, that's his starting wage for a
That would be
deputy.
a new deputy starting wage.
Okay, what is it for the corporal that's gonna be in the school?
Well, that's what we have in there now.
The new position's not gonna be a corporal.
Oh, at the last meeting, I believe Sheriff Brown said it was gonna be a corporal.
We have a corporal in there now, which is Corporal Ferguson. The other one would be a deputy's position. If I said it out, then I misspoke, but I don't recall saying that.
So we're just looking for 14,000? That's what I'm hearing.
Essentially, yes, that would.
And Susan, it's a swag. It's about that. I can't tell you it's exactly that amount of money, but it's very close.
It's, to me, it's a chicken and an egg thing. Do we give Andy approval to hire a deputy before we have a 28E? No, we have the 28E first before we hire a deputy.
Can you speak to that?
Don't we need the money first before we
Huh?
go to an AD?
Yeah.
It's actually essentially agreement.
There is a little chicken and egg action there, but I think it'd be tough. Schools aren't gonna sign a 2080 unless they know that there's gonna be a position to put in it. But I think you could probably approve a conditional, I think you can make some sort of motion that said, we can approve this in principle for the addition of a position conditioned upon reaching a satisfactory 2080 agreement with the 5 school districts. So I think that'd be a fine motion that would satisfy, that problem. Because you do sort of have to have both.
Sheriff, when would this position start in the schools?
Technically, it wouldn't be till the fall school year, so it would be after July 24.
Okay,
But we need to get that person hired now. So they can get to the academy, yes, because we're talking a 5-month academy, field training, all that kind of stuff, and they won't even be available until.
So we're kind of talking about two different people here. Because the guy he's talking about is the new guy, the new position, that's just gonna be a road deputy, blah, blah,
Okay.
blah, blah, blah. There's gonna be a senior member of the sheriff's office that's gonna go into the school resource system. Does that make sense?
yes.
That indemnification language, I think, is gonna be darn important that we get put in there. I think there's some current cases where both school district and municipalities are both getting sued. And
I mean, it's a little different.
how dicey that is this an ICAP thing then?
Yeah, so the city's in a different spot because they're self-insured. And so I think, I'm not familiar with the litigation that's going on. I know that there is some going on, but since we're covered by ICAP, we have a $10,000 deductible. In the event of a claim, we have a $10,000 deductible. So that's just flat, that's what our cost is in any claim. Since the city is self-insured, which means they don't have an insurance policy, they have to cover their own defense. Then in the case where a school and the police get sued and out of the same incident, they have to figure out a cost-sharing agreement for the defense because the school has insurance, and so they're getting, defended by the school's defense, insurance defense attorney. This police department does not, and so I think that they've entered into a sharing agreement where they're paying a portion of the defense costs of the insurance defense lawyer. We would not be in that same boat because we have ICAP, and so we have our own counsel. I don't disagree with Scott. Regardless, we need to have a clear responsibilities and indemnification clause. I don't think it'd be a very complex one, but it's definitely something I'd want to have, tightened up so that we don't run into any sort of problems.
And just to piggyback on what Matt said, the other safety valve we have is the deputy would have qualified immunity, as opposed to anybody in the school who does not.
That's the portion I want clarified is that, the agreement that I see in front of me right now that is currently in place makes it clear. Ferguson is a sheriff's employee. He is not a school employee. He's not to be hauling kids down to the office for detention. If he needs to do something law enforcement wise, then he needs to do something law enforcement wise. But he's not to do that. So the school is responsible for school issues and the sheriff's office is responsible for sheriff's issues. The only part that makes me at all half nervous is what if somebody makes a claim that Ferguson was stepping outside his role as a deputy and he was acting more as assistant principal. He does not have the qualified immunity in that instance for that claim. And I'd want to make it very clear that if anybody ever made a claim like that the school's insurance would defend him. That's the protection, because we have a lot of protections for law enforcement just because they're in law enforcement. I want to make that very clear that if somebody tried to make that claim, we're not on the hook for that, because I don't think ICAP would want to defend that either. That's not part of our insurance coverage.
And the Supreme Court has made some kind of with decisions about school resource officers where it gives them more ability to search and seizure, things like that, if they're asking at the behest of the school district. So we'd want to get that shook out. I used to teach the legal part of the SRO program across the river, and that's one of the things that we pounded into our SROs' heads over there was there are some cases where you're acting at the behest of the school district, and you have to be clear.
When this is going way back, like 15 plus years ago, but I know that I had a meeting with staff, with police department and staff with Council Bluffs Community Schools, because it looked like the police department was citing or arresting a lot of kids in schools for things like disorderly conduct, assault, and somebody walks down the hallway and drops the F-bomb. Technically that's disorderly conduct, right? But we don't really want to see criminal cases beginning out of that. And the school
That's more
district-
vice principal.
Exactly. The school
Okay.
district at that time was sort of offloading disciplinary issues onto the resource officers.
Okay.
And we had to have sort of a sit down and say, this is not, we don't want to be criminalizing kids over dumb hallway hijinks, right? And so, had a nice meeting with them, and I think they, I haven't seen any of those issues in well over a decade. I mean, I think everybody pretty much understands SROs do law enforcement, they do not do school discipline. I didn't want to see kids charged for things in Council Bluffs that they're not getting charged for in Riverside or Traeger or Lewis Central. And so, I mean, I think now, so those are the types of things you want to make sure that you tighten up a little bit in a 2080. But I don't foresee any issues. Again, your decision on whether you add the position, but if you add it, the contract's, I think, pretty easy to write.
Well, would you put the,
You want the screen down?
yeah. I think also, when you start the discussion of a 2080 agreement, there needs to be an escalator clause in it as well. Our insurance rates go up anywhere from 5 to 10% a year. Salaries go up anywhere from 3 to 7% a year. That should be in there as well. I mean, we got ourselves in a position with the cities that pay for additional sheriff protection that we haven't increased those for, I don't even know how long.
I think it's been 3 years.
So that escalator's an important part as well. And I brought this, I had Jamie bring this up, just so you can see, you can't see anything, just so you can see why it's important that the school districts levy for this position. As you see, if you tax everybody in the county, we're taxing people that live in the Missouri Valley School District, the Griswold School District. Also, we would be taxing people in Council Bluffs, Carter Lake, Crescent, and the Lewis Central District for an officer for those schools. The only fair way, in my opinion, to pay for this position is the school's levy for it. And I mean both positions, not just one, both. I mean, maybe that can be negotiated with the schools. I haven't spoke to them. I don't think anybody has, except for maybe the sheriff, but, and then we don't, as you can see, Tri-Center School District extends into Harrison County. We have no ability to levy those people who are in that district for a school resource officer. Then if you look at AHSTW, they expand into Harrison County and Shelby County. We have no ability to tax in Harrison or Shelby County or even the city of Shelby. So, as I mentioned at the last meeting, if we have an opportunity, even though as complex as our tax system is for counties, if we have an opportunity to make this equitable and fair, we should do everything we can to try to get that done.
So, I don't disagree with your premise, Tim, but the funding for this is not coming from tax levy money. The funding from this is coming from the Department of Public Safety through a grant from Governor Reynolds. So the schools were able to take $20,000 from this grant system. They encourage multi-school districts in rural areas to do school resource officers. And each school district is getting a $20,000 check from DPS, and that money is just being transferred over to Becky Linehan's line item. So there's no levy money from the schools involved in this program.
How long is the grant available?
We don't know. And Susan and I had a discussion about that. It's gonna have to be something that we visit. I've talked to DPS. They believe the grant is strong, that there's statewide support for it. The governor obviously has put this full-time position in DPS. They've done the school audits across the state. So they believe it's gonna live, it's got legs. but I can't guarantee that. And I think every year, if they come back and say we've lost the money, we as a group are gonna have to revisit this. Now, Ferguson's position is not paid through that grant.
Exactly.
His position is paid through our sheriff's office budget.
Which is taxed out of the general fund.
Absolutely.
And that's the scenario I'm showing is the fair way to do it is to have the schools levy for it. And, if the grant doesn't, increase every year, do we just put the insurance costs, the salary costs, the car costs back on the taxpayers to pay for it?
That would have to be a discussion, as you and I have had these discussions before, in county government in Iowa, we budget year to year. We don't do 5-year budgets or 8-year budgets. So every year, if they would pull the money back, we would have to sit down and have a discussion whether this position continues.
So you're saying then that this 28E agreement would be a 1-year agreement?
I think so, and a renewal, yeah. I think that's important for us and you guys, to have it as an annual renewable. And that's the way the operating agreement is right now with Ferguson.
So
It's
are
a
we-
1-year.
Sorry. So are we gonna continue to have 2 separate agreements and have Deputy Ferguson work under the operation agreement?
I guess I would defer to Matt.
Nah, I'm sure we would just fold in the terms of my thought is we'd fold in the terms of the operating agreement into a 2080 and we would just have one that applied to everything.
So both positions would be funded the same way?
No, the one position would still be funded completely through us. And the second position would be funded through the grant.
80%?
Yeah, pretty close. And again, we're throwing, mud at the wall. We don't know exactly. Right now, and as we discussed, I don't think we need new money from you for this position. The sheriff wanted to bring it on early to get through the hiring process and get all that stuff going, so we could get him into an SRO school, which the superintendent's demand of that position, that they be trained and skilled. The only reason that I hedge my bet a little bit is we gave David $50,000 for the new IT position. And so my cushion, we've been too short deputies since July 1st budget start. So we've got some fluff building up in there. I hate to call it fluff, but obviously 2 vacant positions, bringing that money in. But we did give David $50,000 out of that line item to fund that IT position. So I think we'll make it to the finish line, no problem. But I don't want you to be shocked if I come back in March with Becky and say, you know what, we're gonna have $20,000 amendment or a $15,000 amendment. Now, historically, we've never asked for amendments before, but I just wanna put that out there to be transparent, that this could happen.
Also, I'm going to amend my answer. I sort of feel like maybe we would need 2 agreements now. The only reason I'm saying that is because the sheriff doesn't sign a 2080, you do. And this is sheriff's employee, so you handle funding issues, he handles supervision issues. So I sort of feel like, I probably would want a 2080 that covered financial issues, indemnity issues, if escalators, if you want them, all of that stuff. But I would probably say that it should be a separate agreement with the sheriff for the actual operations and roles, because that's something that he's in charge of.
Sheriff, there is extra schooling for the SRO officer,
Yes.
and that takes a number of months.
I think it's typically about the federal one's 2 weeks, isn't it? There's local and federal schools, and it's the federal one that they have to have essentially is 2 weeks.
Okay, so our deputies are out in Riverside or Underwood, Avoca. If there's a mass emergency, are they available
Oh, yeah,
at that point,
yes.
other than the school? They can leave the
Are we
school.
talking
and-
about emergency in the school?
I'm
Another school?
talking other than the school.
Yeah, they could, yes.
Okay,
I mean, we wouldn't, that would be our first choice, if we couldn't find people that are already working to help with this mass event. If they have to leave the school, we'd have to leave the school.
And that's in our operating agreement currently, that we could pull them in case of emergency.
so by the time that the school grant comes available at $100,000, and then we have that officer for 2.5 months available to the sheriff's department, It's kind of a push, isn't it? On money?
Well, like as the chief just explained, we are 2 deputies short, so that money is kind of there. That's
But
why it's
then
gonna be close.
They could be doing whatever you need them to do
They
with
can do
2.5 months.
Yeah, and if it's one that we have to hire brand new, they'll be in the academy anyway, getting trained, so.
I think this is a good deal. I think we need it. I think our world's crazy anymore. I'm scared of people in large situations. What's more vulnerable than our children in the schools? We need some supervision, and I am for this.
Disagree with you.
When's the next academy start?
January.
January 5th, I think.
How
We just got
often do they
notice.
do it?
They
How
do it 3
often?
times a year.
How many?
3 times a year. Usually January to spring time sometime, and then late spring to summer, and then through the fall.
Who would negotiate the 2080 agreement? Is that, do we put a team together? Somebody on the board?
I'm open to whoever you want. I mean, I obviously want Matt or one of his assistants in the room.
Could you work with me?
I can work with you any day, Tim. We
I
can
don't-
build fences together.
Pardon me?
We can build fences together.
We could do all kinds of things. I don't have any issue with taking a look at it, and trying to get the 2080 nailed down and, you have 14 people, right? In the pool right now?
We have 18 people in the pool for potential hires.
Although you said 14 past.
We have 14 that passed, yeah, so the 14 that passed were the ones that are brand new and never been certified. We have 4 certified officers applying for us as well. So we have 14 brand new, green, young men and women, and we have 4 that are already certified with other agencies.
Okay, I think we can take a look at the current position that we have right now and discuss it, because it ends this year, or this fiscal year, and discuss how it's paid for. And if they have a grant for the rest of it, I think that we can move forward with some kind of a 2080, an acceptable 2080 agreement that's favorable for the board, favorable for all the school districts. Have you met with any of the districts?
Yeah, we have all of them.
The school board meetings?
Well, we've got the superintendents.
The superintendents took it to their boards. They wanted, and that was their choice. They wanted, because we said we'd be available for the board meetings. They said, no, we want to take it to our boards. The other thing I want to caution you on the 2080 is until we get the paperwork from DPS and all the grant stipulations, it's going to be hard for us to write a 2080 until we see what their requirements and just fiscally on what's going to happen. I've talked to Becky already about establishing the $100,000 line item and the revenue, all that. But until I see that paperwork from the state of Iowa, it's going to be hard for us to write a 2080.
Is the school's approval contingent on that grant?
Oh, they have the grant. But we haven't seen the paperwork yet. And it's the Tri-Center soup that's kind of running it, right? She's kind of.
Is that the one that's signed?
No, there's a,
Who's Mike Bowles?
That's the operating agreement.
Yeah,
We have not seen the paperwork
Who-
yet from
who is
DPS.
that a board member or something?
A school board member.
That's a school board member, it says district board president.
Yeah, the
Which one?
president of the
So,
school board.
we'll have all the districts signed?
They've signed it all,
Oh,
yeah.
okay.
You just sent one.
Okay,
Oh, okay. Yeah, that's our fault.
okay.
well, this is under the, let's not get, see, this is what happened last time. We had 2
Right.
questions for Junior. This was the agreement for Kurt Ferguson. The school district chair is the only one that signed it besides me. But all the supers we met with out of the 5 school districts and went to their school boards and got approval for this, then it went on to him to sign as well as me.
Okay,
This is the one for Ferguson.
yes.
Yeah, but Ferguson is spending time at all those other ones too, right?
Yes.
Okay.
Yeah, because this, Mike Olson, I've never met him before. He was
Right.
not he must be the one that sits, he's the chair of the school board.
Yeah, I would guess.
School board's up.
It doesn't say what school district.
Yeah,
You know.
there's not a joint unless it's through the Green Hills Agency.
Well,
don't have an association of the 5 roads.
Jeff, if you go back to your comment, until you see the paperwork,
I can't write a
what's-
2080 as
what's
a
your
lawyer until I
concern
see
about
what
that?
they want from us. You see what I'm saying? I don't know what fiscal stipulations, when the disbursements are gonna happen, those kinds of issues, and I won't speak for Matt, but I'd wanna have that before I wrote a 2080.
So you're not even considering hiring this person? So you're looking for some kind of a approval for a position that may or may not happen?
The position's gonna happen, we wanna hire for it. That's what we're trying to get, we may be putting the cart before the horse, but the schools will approve this because they're the ones that came and said that they will do this 2080 with us for the second position.
You're asking what that is.
What if the paperwork doesn't work out for us?
Let's ask him.
What if there's things in there that Jeff doesn't like? Hey, we can't do that. We don't know what's in it, right?
If it goes south, we'd have to come to you guys and say it's gone south.
But we've already hired this guy.
Believe me, we will have vacancies. We will easily assimilate that vacancy back into the system. I know of one vacancy that's occurring fairly quickly.
Well, I appreciate all of the extra time that the deputy spent with me. I talked to 2 or 3 of you, and it's a valuable program. It's kind of goes with our last hour discussion with the medical examiners. We've got to figure out how to fund it. It makes great sense. The value, we'll never know the value because the metrics I was asking for, they don't exist. You can't. The near misses, the opportunities that didn't take place because we had a school resource officer in place, you just can't measure those.
No, I can't agree more. I think it's a fantastic opportunity for grooming, I hate to use the word grooming, but exposing, young men and women to the profession of law enforcement, and whether it's 911 or EMS or any of that, stuff. I mean, seeing and touching them on a daily basis can be pretty rewarding for probably some of those kids.
And we have the right person in the position now, and I know our next pick will be just as good. And we've had nothing but positive feedback from superintendents, from principals, from teachers, I mean, parents. Has started as a very rewarding program, so.
Andy, I'm all in favor of helping you on this project here, but I don't know how to make a motion in what way. Matt, you made a suggestion for a motion. Are you still willing to
Sure,
move
I mean, I
forward
may
with
need
that?
to sort of reclassify, because I wasn't aware, so I didn't realize, I mean, now I know what they're looking at. They have somebody already in the sheriff's office that's already an employee that they want to assign as the new SRO. But to do that, they need authority to hire for a brand-new rookie to come in, so that they've got time. So they really are looking for 2 different things. One is authorization to enter into a 28E with the schools, contingent upon grant funding. I mean, I think that's one of your motions. The second motion would be to authorize them to add a deputy. I mean, you probably could say contingent upon the SRO. I mean, you could figure out a way to do that, but they're not looking to hire an SRO. They're looking to hire a new deputy, which frees up a current deputy to become an SRO.
Correct.
Am I right?
Yes.
Okay.
Right.
Okay, all right.
And like you said, worst
Makes
case
sense.
scenario, if we go down the road with this thing and have somebody hired, and it doesn't work out, which I highly doubt it's not going to work out, come May, we have vacancy, and then we just eliminate that position. We already have somebody hired for him leaving, and we're back where we started, so.
So the first motion we would make then is to grant the hiring of a new deputy. Flat out.
Yeah.
Okay.
Sounds good to me.
Yeah, I don't even know if you need a formal motion. If you just give me the go-ahead to start talking about a 28E, that's all I really need to know. I mean, if you need to have a formal motion on it, you can move to have the county attorney and the sheriff work with a board member to begin drafting an acceptable 2080 agreement with the rural school districts. I think that'd be a
Well, I'll
fine.
leave it to the chairman to figure out how best to move forward, but I'm supportive of the
I
chair's.
think we do need to work the 2080. We could make you could make a motion to approve contingent upon the county attorney approving the 2080 agreement with the sheriff and the school districts.
I mean, regardless, in the end, any 2080 agreement is going to have to be brought to a meeting, and you will all have to agree
Right.
to that.
Okay,
Well,
but
three
not-
of you.
So,
Now, what I
this
say-
would be kind of redundant at this point.
Well, what I've been hearing is the hiring, whether this person is being hired as a new deputy to replace the one that's moving on to the schools. I mean, you'd have a new deputy on board that would probably be needed anyway because of retirements or whatever. Is that right?
That's correct, yeah. I
So-
mean, that's, I think, vital right now today is to get, at
So,
least you guys
okay,
had approved me to hire another.
okay,
extra.
and that's just make it simple. That's that's where I'm headed.
Yeah.
At this point. Okay, and then everything else, the 2080, school signing papers to get all this done and grant writing and all of that, that would be another separate motion issue or whatever,
I don't think it needs to
or
be
time
just a
spent.
direction to us.
I don't, yeah, as long as I know that the board's giving us direction to start negotiating those drafting and negotiating the terms of that 2080,
Okay.
I'm comfortable with that.
Okay, I would be all for.
It's on
giving
you if
that
you pull
grant.
the Charlie Brown football back from them
Yeah.
later. I mean, that's, you guys will pay that price. I won't worry about it.
All
I'm
right.
more than happy to chat with the school boards and the sheriff and the board and make sure we have acceptable terms that everybody can live with. I don't think we need a motion for that. You would just need to approve him to have the additional position.
And just to make you feel a little more warm and fuzzy as well, this was their idea. When we came to them with Ferguson, they are the ones that brought this to us saying, we want a second, here's how we're going to do it, and all the supers have already approved this and the school boards have. So it's not gonna, it's gonna be a no factor.
High degree of confidence that
Yes.
this will be a zero issue.
Okay,
Andy, can you get us a copy of your estimate of cost for a deputy?
Right there.
And then, on the light side, Mr. Thulin, in the last paragraph of the existing agreement that we have, do you have a copy of that?
Not with me, no.
Matt, do you have? Would you share that with Jeff?
Where are we looking?
And the last sentence, it says that the.
City board meetings.
Oh, the city property. Yeah, no,
Are
the
we
county
giving our-
attorney
Are we
pointed
giving-
that out to me.
Are we giving our motor vehicle and stuff to the city?
No.
Might, I don't know. No, that's our fault. We missed it. You can let your imagination run of where this was taken from.
We would call that a scrivener's error. It does
Yes.
not affect the validity of the contract.
That's right.
But it is.
When you
We
have
look
the
at the four
meeting,
corners.
when you have the meeting on the 28 agreement, let me know. I'd like to be there too.
Okay.
Okay. Jeff, are you making the motion?
I make a motion to allow the deputy or to hire an additional deputy for replacement purposes and just go from there.
I thought the motion was just gonna move forward with the 2080.
No, I don't think there was gonna be a 2080. My understanding was the motion that you would have to approve as a board, assuming three of you agree, is that you would authorize him to hire a new deputy. I don't need a motion to work on the 2080. I think everybody understands we're gonna be working on that, and what they're going to do is use the new deputy to backfill the SRO position that they're gonna place.
And that's the motion I just made.
Oh, it's gonna be an additional deputy to
Just an
backfill.
additional deputy should be fine.
Funding an additional position.
All right, we'll just put deputy instead of school resource position.
Okay, got a motion on the floor to approve one more hiring of one more deputy. Need a second.
Can I ask a question first?
Yes,
In the fund balance report, Mitch, there's Fund 18 and it says Special Law Enforcement Fund and it has a current balance of $128,735. What's that for?
Seized assets.
say that again.
Forfeiture money from drug money. We can't use that to pay for the position.
We can't.
No.
Okay.
Weren't we
Can't blame
using
you for
that
trying.
on a possible building, weren't we?
That's probably where it's probably
Okay.
flowing towards.
The, I think, Andy, you said at the last week's meeting that in your budget, there were 2 positions that aren't filled yet.
Correct.
All right.
We have, they
So
both went to
you-
different agencies, some one DEA and the other one went back to a smaller agency.
Say that again.
We, the reason, so here's when it comes to civil service, why we're short. We test once a year. So we have a once a year testing, and we keep the list of the people that are certified after that testing for a year. So that's why we have been too short since July, is because 2 left for different agencies, and we couldn't hire anybody until we retested here just a few weeks ago.
But you have 2 people in there right now that you have funding for, that you don't have hired.
Correct.
Okay.
And that's how we kind of got away with the deal with David, and we're gonna hopefully get by with the rest of this money that's left over from the.
So you already have money in your budget for a position?
I'm not following you, Tim. Like what position?
For a regular deputy.
We have 2.
I think we can get there, Tim. I'm not 100% confident, but I think on the money we have in our line items, this is gonna have no fiscal effect on you guys. I think we're gonna be able to cover this. But like I told Susan before, my only step back is, we took 50,000 out of our personnel line item to pay for David's IT guy, which is sorely needed. David and I, and us, we all agreed we needed that IT position. So I made that line item a little tighter than I'd like to. I think we'll get fine, and I'll work with Mitch, but I think Mitch would agree with me. We'll probably make it to the finish line without any fiscal ramifications. And then the 100,000 will come in July 1st, so.
To Tim's point, I think you have 2 vacancies right now that you want to fill. You also want to add this position.
Yes.
That's right.
It's not that he wants to, he's down 2, it's not that he wants to be down 1. He wants to fill the 2 that he's down.
We're
plus-
paying overtime on the road right
plus
now because we're
authorize
short
it.
on the road because of those 2 positions.
Okay, so do we need a motion for you to approve one more deputy?
Yeah, we need the position.
Okay, Jeff's got that
Second.
okay, there's what I needed. Got a motion and a second to approve a new deputy hire.
One more question.
Yes,
So you have budgeted for 2 positions that aren't filled. You filled one of them. You filled none of them.
We haven't filled any of them yet. We're gonna fill them in the next
Few weeks.
6 weeks
Fill them with what?
With deputies.
with deputies, new deputies.
And then one of those deputies is gonna become,
Those 2 deputies are going to the road where the vacancies exist now.
so you want approval to hire a deputy for the school?
Yes. Out of this, what we've discussed, this future 2080 will be that deputy will be the $100,000 income July. But we want to hire him now because we'll have to get him trained. And we can absorb, we're confident we can absorb the cost, so.
you got a
Jeff's
question?
motion is gonna pay for the new deputy to come in, take that road position. We'll drag the road position deputy to the SRO.
I follow you.
And we need,
Which happens in
July.
August of next year.
Oh, August, you're right.
So,
you mean the school or the? School. The SRO training will start happening in July of next year. Or earlier if we can get in the school.
But you have to hire that person now.
We have to hire, they have to go through, this new guy that's gonna go to the road, we got a 16-week academy lead time, an 8 or 10-week hiring lead time. It's gonna take months for us to get that person, 15 weeks field training. They will not be on the road by themselves until probably next July 1st.
so you don't want any money for this position, you
No,
just want the
not
authority
right
to
now.
hire a position? I'll give you the authority to hire 20 guys if you don't want
Okay.
any money.
Deal. No, we don't think we'll have to come to you for money, but I don't wanna say absolute.
Guys, I'll give you the benefit of the doubt. I trust what you've researched and take a look at this, so.
We got a motion by Jorgensen and a second by Belt to approve hiring another deputy. All in favor signify by saying aye.
Aye.
Aye. Those against, motion carried.
Thank you.
Cool, and then we'll work the 28E. Okay?
I got a new partner in crime to help me, so.
Cool.
Be nice to.
Let us know.
No.
She's been very good to us already.
Thanks for coming in. That was a good discussion. It really was. Okay. Anybody got anything on,
And I won't put city in.
committee appointments?
I attended the East Pot Soil and Water meeting last Wednesday, the Thriving Family Alliance Zoom meeting, and I was on the bus that went to Des Moines for Advance Southwest Iowa.
I did, I.
Went to Advance Southwest Iowa, the bus trip to Des Moines, done an opioid seminar.
That's a general attorney.
I guess that was about it. Okay?
Napa. They're doing their transportation projects and stuff, and wasn't, they're really short on bodies, and we just made the form by one.
Oh,
The
God.
thing is, next, or it'd be your first of the year, the NARC conference is at the same time as ISAC, so.
Okay. Well,
NARC is stands for National Association of Regional Councils. It's
Okay.
It's not NARC.
So did they plan them intentionally the same time? Or
No, they
just-
don't,
They
they
don't
don't talk
They
to
don't
one
speak.
another.
Okay.
well, I think we had healthy debates today during the meeting, and I really appreciate the board working through those issues. So I need a motion to adjourn.
No.
Public comments.
Oh, oh, God.
We do have one,
Oh,
public comment from.
we got public comments?
Shauna.
Now begins our public comment portion of the agenda. In an effort to protect the privacy of individuals and reduce the potential broadcasting of defamatory and/or confidential information, our live broadcast will now end. Information regarding public comments and public comment policy